Aaron, thank you. It's 6:33 on a Monday, and for weeks now, we've been hearing about Western New Yorkers testing positive for COVID-19 at about 1 or 2%. The state as a whole is reporting even fewer positive tests each day. So what does that actually look like inside the ICU, and what lessons have been learned? This morning, I'm taking you back inside the ICU 5 months after our initial visit during the worst of the pandemic. The April chaos of COVID-19
Next door, 18.
can only be described 5 months later as a memory.
We're much back to our regular patient loads.
Lindsay Acevedo is the charge nurse inside the ICU at Millard Fillmore Suburban Hospital, where months later, doors are open, beds are empty, and COVID cases are down a lot.
We really don't see positive cases coming in anymore.
Why do you think that is?
I think that we're learning a lot more. We know a lot more about the virus. It's being treated better. Waiting as long as we possibly can to intubate people is actually proving to be better than intubating them very early on. It's a virus, and it's just one of those things that you have to let it wait its course.
1, 2, 3.
COVID has run its course through this unit. In April, during our first exposure to life on the front lines, 15 of 19 patients on this floor were COVID positive, denoted by white tape on the doors. This was Acevedo 5 months ago.
I didn't think it was going to get this bad. Having to put on all of the PPE, you want to do it as fast as you can, so that makes you nervous.
Fast forward 5 months, PPE is still worn walking into a COVID patient's room, and to the same extent it was during the worst of it all, only with a different attitude.
We're so used to it now. It's in our mind, so it's not as scary getting everything on as it was before.
On this day, there was only one COVID patient in the ICU. She'd been there on a ventilator for some time. Hospital-wide, only 2 patients are COVID positive. Has the mood shifted among the nurses?
Absolutely. I mean, I think that everybody is so much more relaxed now. Everybody's okay. We've dealt with it. We're not scared. We're cool.
This confidence comes with experience. Through it all, there wasn't a single patient-to-patient exposure, nor was there an ICU nurse who tested positive after treating patients. So ask Acevedo if she's prepared for the future, and she'll give you an honest answer.
People are still going to get sick, and everybody's going to be afraid that they have COVID-19. But the reality is, they probably don't. We've done a great job of wearing masks, staying away, washing our hands. And if we continue to do those things, we don't need to live in fear.
Acevedo says the majority of patients in the ICU have been older and over 60 years old. Throughout the entire Kaleida Health System, right now there are a total of 10 COVID-positive patients in 5 different facilities, so those numbers are dropping significantly.